Hello, everyone, and welcome to Connecting the Dots with Dr. Ashaye. This is a great place to be if you desire to take charge of your health so you can live fully while enjoying doing what you love. So I had a patient a few years ago. She was weak, she was dizzy, she was tired all the time, and she had heavy periods, right? But she was just dealing with it. Well, after a while, she got tired of just dealing with it and decided to come get it checked out. Turned out that her hemoglobin was 5, so she needed a transfusion. So many people don't get to that point, hopefully. Many people, but I do know several people who have anemia and just, continue to deal with it. But if you are listening to this and you have felt weak, tired, or you're eating more ice than usual, or craving things that you shouldn't crave, and we're going to be talking about how to address anemia today, so stay tuned. But before we get into it, you're listening to Connecting the Dots with Dr. Ashaye. I'm your host, Lola Ashaye. I'm a family medicine and lifestyle medicine doctor and owner of In Touch Primary Care, a membership clinic in Sugar Land, Texas. And I am so excited that you're here. If you're seeking a more convenient and proactive approach to your healthcare, come join us. You can enroll at www.intouchprimarycare.com. And remember, you can always listen to this episode and all our episodes on the In Touch Primary Care YouTube channel. Leave comments, subscribe, and please share. Share with someone that might need it. You never know, it can make a huge difference for them. So let's get into it. What is anemia? So anemia is when the red blood cells are low. So your red blood cell count is typically measured by a test called a complete blood count, or CBC. And the most widely used measurements on the CBC to check for anemia is either the hemoglobin or the hematocrit rate. And hemoglobin is a substance, actually a protein inside the red blood cell that carries the oxygen from our lungs into the tissue. So it's very important, right? Because we need oxygen to get into the rest of our body so that all our organs can function properly. So obviously, if we don't have enough hemoglobin, that's going to be a problem because you don't have enough red blood cells to go around the body to, so that your organs have oxygen. The other thing to understand is that your red blood cells don't live forever. So when they're created, millions of red blood cells are created every day. However, once they circulate through the system for about 120 days, they go to the liver and the spleen to be pretty much destroyed, and then the parts of the red blood cells are recycled and used again, components of the red blood cells. So we are constantly having to make red blood cells, which means we need the raw materials all the time to be available to make red blood cells so that we're not anemic. So in order to make red blood cells, our body needs hemoglobin. We talked about that, and hemoglobin requires iron. So many people know that when you're anemic, iron deficiency or not having enough iron can be a big part of that. So in some cases, that's a cause of the anemia, not having enough iron. But there are other causes as well, and other vitamins that are necessary to make red blood cells. Other vitamins are like vitamin B12, folic acid. Those also play critical roles in red blood cell formation. And so when you don't have enough vitamin D or folic acid, for instance, the cells are not formed properly, and so they're destroyed prematurely. And so people, again, can develop anemia because they don't have enough vitamin B12 or folate. So anemia is a very common problem, but it's also a very general term because there are different types of anemia, okay? So, and there are different causes of anemia too. But basically, it's that either the person is not producing enough red blood cells, or the person is destroying the red blood cells faster than it can produce it. So anemia can be caused by, if someone is losing too much blood and your body is not able to keep up with producing enough red blood cells to replace the ones that are lost, or it might be a production problem from the get-go. But some of the symptoms people experience from anemia, they may feel weak, they may be tired, their skin may be pale, their hands and feet may be cold. Sometimes, though, they can have things like even shortness of breath, chest pain, irregular heartbeat, because putting more pressure on the heart or strain on the heart. And sometimes people can even have like mouth sores, inflamed tongue, and then, desire to eat foods that are not, food, like sand or ice, that sort of thing. And some people develop like brittle nails, so their nails are very easy to break easily. So it's very common, especially in women, and that's because women have periods monthly, but some women have very heavy periods, because if it's just from monthly periods, normally your body should be able to produce enough red blood cells to handle it. But if the periods are too heavy or too long, that can cause, the body's not being able to keep up with the demand and make enough red blood cells to compensate. So that's one of the more common things that people hear about. But anemia can also be caused by medications. So for example, we see people that take in NSAIDs, like things like ibuprofen, Aleve, Advil, for a long period of time. They can, or even aspirin or steroids, when they take for a long period of time, it can cause bleeding in the lining of the GI tract, of the lining of the esophagus, stomach, going down the inside. So if that lining is irritated, you can get a little bit of bleeding from that, or a lot of bleeding, and that can cause anemia. Other medications, like medications used for acid reflux, the proton pump inhibitors, some examples of that are Protonix, Prilosec, Nexium. Those are all the brand names. But some of those medications, also H2 blockers, some examples are Pepcid, Zantac, and then antacids like Tums. All of those can impair the pH of your stomach. So basically, they make the stomach less acidic, they increase the pH. And when you do that, that can reduce the absorption of vitamin B12, which can also lead to anemia, because we discussed earlier that you need vitamin B12 to help with forming the red blood cells. So then there are medications that interfere with folate metabolism, so things like antibiotics or anti-seizure medications, or methotrexate, which is used for cancer treatment or rheumatoid arthritis treatment. Things like that can also, if it affects folate metabolism, it can also affect the red blood cell production, causing anemia. And then one that people may not think too much about is too much zinc. So with COVID, a lot of people were taking zinc to boost their immunity, but taking too much zinc and ingesting, which can be a form of supplements, or some people use dental creams, and too much zinc can cause copper deficiency, and which affects iron metabolism, and so can also lead to anemia. So these are just so many examples of ways people can develop anemia. Sometimes it's even dietary, because if people that are vegan, for example, don't get vitamin B12 in their diet, that can lead to anemia. Or elderly people who do not get enough vitamin B12 in their diet, or iron, because they're not eating very well, that can also lead to anemia. So anemia can also be caused by an inherited condition. So some of you may have heard of sickle cell anemia or thalassemias. Basically, with sickle cell, the red blood cells are abnormally shaped, and so they are weak, so they break down easily. And because you are having to produce them, they're not staying in the system for as long as they should. And so you need to produce more and more of them. And so that can cause anemia. And then you have thalassemias, which is caused by mutations in the DNA of the cells that make hemoglobin. So again, there's not enough hemoglobin, then you have anemia. So the point is, there's so many causes of anemia, okay? And many different things, and even similarly little things that you may not think about: medications, your diet, too much blood loss. And sometimes because especially with blood loss, when it's slow and over time, some people don't really notice it. They don't realize it's that bad because the body just keeps adjusting to some extent, but it's actually putting a lot of strain on organs. So it's really important that it's addressed. So what can be done? Say one of these things applies to you. You have been diagnosed with anemia, or you suspect that you have anemia. What can you do? The first thing that you need to do is you need to talk to your doctor about your history and do the blood test, do the CBC to start with, because that will help us identify exactly what type of anemia it is, and that will help better treat it. So, for example, a lot of people just, oh, I think I have anemia, I'm going to take iron. Well, if it's not because of iron and you're taking iron, that doesn't help, right? So if it's because of vitamin B12 or because of folate, or if it's an inherited cause, we need to know why. Why are you anemic? Because if we don't know why, it's going to be difficult to actually address it. So that's the first step. So for women, a lot of times it's obvious, especially women who know that they have heavy bleeding. It can be pretty obvious that, they have anemia because they're bleeding heavily, but that may not be the only cause. So it's important to, check, have your history, discuss your history, and then after that, we can check the labs and go from there. Number two, the next step will be to treat the root cause. So sometimes I see, people just taking supplements to fix the anemia without really addressing what is causing the anemia. So let me explain. For example, someone knows that they have heavy bleeding. Instead of, trying to figure out what is causing heavy bleeding and trying to fix that, we're just, taking iron supplements, and then maybe they have side effects from the iron supplements. So they either stop it, or now they also have to take a stool softener. So it's like just adding things on instead of really trying to solve the root cause. So, I encourage people that have anemia, if there's a reason for it that can be addressed, that should be addressed first. Because if we address that, then maybe after a while, you don't need supplements anymore. But it's important that the root cause is addressed. And then the third thing will be to monitor your labs following. So sometimes, for example, a person has anemia, maybe they even needed a transfusion. They got the transfusion, they followed up for a few months, and then, they think everything is fine, but they don't follow up a year after or 6 months after to confirm that the body is still keeping up with the production of red blood cells. So it's really important to actually go ahead and continue to monitor your blood counts. If you have anemia, make sure that whatever treatment, if you're treating the root cause, make sure that that treatment is working. And then also, it's so important to actually treat the anemia initially. So treating the anemia, instead of just feeling tired and weak all the time, especially, it's important to check it and then treat it appropriately. So those are the things that one can do. In terms of treating anemia, and I'm going to talk mainly about iron deficiency anemia now, because that's one that comes up a lot. There are a couple of things that could be done. So like I said, start off with treating the root cause. In women, a lot of times that women that have heavy bleeding, the root cause might be from the heavy bleeding. In that scenario, maybe taking medication to lighten the period might be helpful. Exercise, physical activity has actually been shown to help to improve periods. So people that have heavy periods, painful periods, that start to exercise regularly see benefit in the change in their period. So that can be helpful. Other things in terms of iron deficiency specifically, which means you don't have enough iron because you're losing a lot of blood. Eating things like beans, dark green leafy vegetables like spinach, dried fruits like raisins and apricots, iron-fortified cereals, breads can be helpful, and peas. So I know a lot of people also want to eat a lot of meat when they have iron deficiency, but I actually don't recommend meat for treatment of iron deficiency anemia because it has high content of saturated fat, which also causes inflammation in the body. So if possible, using those other sources of iron can be helpful, especially those green leafy vegetables that can be really helpful. And then if that doesn't help as much, or if the anemia is worse or severe, obviously if it's severe, then your doctor will have you get a transfusion. But if it's not that severe, doing a supplement can be helpful. A common side effect of supplements is the abdominal symptoms it causes. So some people have constipation or abdominal discomfort or nausea when they take the iron pills. So finding the right type of iron pill can be helpful. There are some iron supplements that cause more abdominal symptoms than others. So, for example, the ferrous sulfate tends to cause a little bit more symptoms than ferrous gluconate, and ferrous gluconate tends to cause a little bit more symptoms than chelated iron. So you can kind of find out what kind of iron helps you and doesn't cause side effects, but it's important to take the iron if you need to, so that you have energy, you feel better, you're able to be more productive, so it's certainly worth it. Now, if it's vitamin B12 or folate deficiency, again, those vitamins are available over the counter, so those can be taken, but again, you want to make sure you're treating the right thing. So the whole point is, if you have anemia, if you were tired, if you felt, weak all the time, maybe you already had chest pain, shortness of breath, don't ignore it. Get it checked out. Go and find out, what is causing this. Find out what blood tests you have to get done and get it done. Treat the root cause, find out what is causing it and treat it, and also monitor your labs. Don't ignore it. Treat the anemia, because it makes a big difference. When you have enough red blood cells, all the oxygen that needs to get through your body is getting through. You feel better. You have more energy. You can think clearly. You're more productive. So it's certainly worth it. It's certainly worth it. All right, so I hope that helps somebody. And if you are in the Houston area, you're looking for a doctor that is proactive about your care, check us out at In Touch Primary Care. We do things differently here. Our practice is set up so that your visits are not rushed. You can reach us easily. You don't have to delay your care. And we can see you even if you don't have health insurance, because we're membership. We're out of network for everybody. So you can find out more on our website, www.intouchprimarycare.com. And remember, your health is too important to rush. It's too important to ignore. You need health to enjoy the fruits of your labor. So don't take it for granted. Hope that helps. Have a good rest of the day. Take care.